Welcome back, everyone. We're going to finish up our HEENT series here with the common nose and throat disorders. Rhinitis is an inflammation of the nasal cavity. This has many causes, including things like allergens, medications, changes in environmental temperature, as well as bacterial and viral infections. Assessment and treatment for rhinitis is really supportive care and providing the patient means to transportation if needed to a definitive care facility. But symptoms include nasal congestion, sneezing, itchy, runny nose, eyes, and postnasal drip. Sinusitis is a inflammation of the sinuses. There are a variety of symptoms, and the morbidity is very high. It affects about 29.3 million adult Americans per year. Some complications that can arise from sinusitis may be sinus headaches or migraines that develop. Assessment and management for these patients, their presentation of sinusitis can be chronic, acute, or recurrent. Monitor for any respiratory compromise if needed. Perform the assessment and interventions that would be required for an airway compromise, but the treatment is largely aimed at reducing the inflammation and draining of the sinuses. Dentalgia or a dental abscess. Dentalgia is just the common toothache. A dental abscess, however, is bacterial growth that creates a pustule within the gums or teeth and can have some more significant complications for sure. It can affect the facial tissue, the bones, the necks, and the nerves. Assessment and management. If the infection becomes systemic, the patient can be at risk for septicemia, which is certainly a life-threatening and emergency. And an abscess in the throat or the neck can affect a patient's ability to breathe. And so pre-hospital treatment is going to be aimed at largely symptom relief, but if it is gone untreated and there is airway compromise, then we certainly would need to manage that airway accordingly. Other diseases of the oral soft tissue, you can see here is a number of common diseases, including things like cold sores, canker sores, leukoplakia, gingivitis, thrush. And assessment of management for these patients is predominantly the ruling out of urticaria and allergic reactions. This is why we stress the importance of an assessment for these patients, as we want to make sure that the symptoms that you are seeing aren't a presentation of a more life-threatening underlying cause, such as anaphylaxis or an allergic reaction. Thrush or oral candidiasis is an accumulation on the lining of the oral mucosa, so it can be tongue, cheeks, under the tongue, of thrush. And it can have a white, sort of creamy appearance and is not terribly uncommon or necessarily life-threatening, but can be startling to the patient and is worth being informed and assessing over. It's most common in babies and patients with compromised immune systems, but can also be seen in patients who wear dentures or take regularly inhaled corticosteroids, as any steroid can cause an increase in the metabolic rate for things like thrush. Pre-hospital management includes predominantly symptom management and care. There can be significant amount of pain associated, particularly if the tissues become cracked or swollen or start to bleed, and may need comfort care and supportive care for that patient. Also, again, as mentioned earlier, make sure this isn't an indication of a more complicated life-threatening disease. So we should be assessing the patient and making sure there's not an underlying presentation that is expressing itself through this manner that may need to be addressed. Ludwig's angina is a type of cellulitis that's caused by bacteria from an infected tooth root or mouth injury. Physical exam can show redness and swelling of the neck, specifically under the chin. Ludwig's angina can create significant complications that need to be addressed in the pre-hospital world, specifically around airway management. These patients typically will present with difficulty breathing or swallowing, neck pain, fever, drooling, and altered speech sounds are also common. This does require aggressive airway management in severe cases. Much like we've seen with some of the infectious diseases of the throat, we don't want to irritate the mucosa necessarily, so don't be probing around in the patient's mouth with a suction if it's not necessary. But if airway compromise is indeed a significant risk for the patient or it's progressing to that point, you may want to consider ALS intervention if you're a basic level provider, and ALS providers should be prepared to engage in aggressive airway management. A peritonsillar abscess is a collection of affected material around the tonsils, and it's a common complication of tonsillitis. You can see here is a video image or a still taken from a video image of the tonsils and where they're swollen with abscesses around. We can see that this creates a narrowing of the patient's airway and can potentially create some airway problems for this patient. So being aware of that and the potential for progression, again, don't unnecessarily irritate the tissue. However, you should be prepared for airway management in these patients should the patient degrade to a point where airway management becomes necessary. Long-term treatment for the abscess itself typically includes antibiotics, but also can include things like an incision and drain, or IND, which is the physical incision of that tissue, draining and then packing of that tissue. That's not done in the pre-hospital world. That would be done in the emergency room or at a physician care setting, but it's something to be aware of. Temporomandibular joint disorders. Causes for TMJ disorders can include things like arthritic damage to the joint tissue, jaw injuries, or jaw muscle fatigue from grinding and clenching of the teeth. Typical presentation includes things like headache, jaw pain, difficulty chewing, or a locking of the TMJ joint itself. These are typically managed by physicians and dentists. Supportive care will be provided in the pre-hospital world, and comfort care of the patients in an extended amount of pain.